to an elementary school playground for a 7-year-old child having difficulty breathing. Upon arrival, you find a 7-year-old boy sitting on a bench and leaning forward in the tripod position. As you approach him, you hear audible expiratory wheezes.
Alright, I got my proper PPE. Is my scene safe?
Yes.
Nature of illness, unknown at this time, could be asthma. I see one patient. Do I have any more?
Just one.
I'm going to go ahead and call ALS, and C-spine, I don't consider this needed at this point. My general impression is a 7-year-old boy with difficulty breathing and audible wheezing. And I'm going to go and check responsiveness. Hey, how are you doing today? Is he responsive?
Responsive but anxious.
Anxious? Okay. And what is your chief complaint today?
It's going to be difficulty breathing.
All right. ABCs, I'm going to check the airway. I'm going to assume it's open because he's talking to me. Is there anything noted with the airway?
Open with audible expiratory wheezing heard.
All right, breathing. I'm going to go ahead and check his lung sounds right now. I'm going to have you take a deep breath in for me and out your mouth. All right. And how are those?
Wheezes in upper lobes, little air movement in the lower lobes.
Okay, and I'm also looking and listening to his breathing. I'm looking at rise in chest. How's that?
Rapid and shallow nasal flaring, use of accessory muscles, symmetrical rise and fall of chest.
Okay, and then circulation. I'm going to go ahead and check your pulse if that's okay. How's his pulse?
Radial pulse is fast, strong, and equal.
And then I'm going to know, is there any major bleeding?
No.
And then how's his SpO2 at this time?
It's going to be 87%.
Okay, at this moment, I'm going to put my patient on a non-breather mask at 15 liters per minute because he is having trouble breathing and SpO2 is very low. And I'm going to consider him a high priority transport, so I'm going to go ahead and transport him. Now I'm going to go into my history taking. I'm going to get his signs and symptoms.
Lungs, expiratory wheezing, audible, auscultated in upper lungs, little air movement in lower lobes. You notice nasal flaring and use of accessory muscles.
All right, and are you allergic to anything?
Amoxicillin,
And are you currently on any medications?
provincial inhaler, located in his backpack in the classroom.
And pertinent past medical history?
Asthma,
And what was your last oral intake?
lunch,
And then events leading up to this?
playing on the playground.
All right. And this difficulty breathing, has it came on gradually or suddenly?
15 minutes prior to your arrival.
And does anything make your breathing worse or better?
Running on the playground makes it worse.
And then if you have any pain, can you describe this pain to me?
Just shallow respirations, no pain.
All right. And so I would assume that this pain doesn't radiate anywhere.
No radiation.
And then I would say, since you don't have any pain, is it possible, can you describe the trouble of breathing, 1 being the lowest and 10 being the worst?
Severe respiratory distress.
And you said this started about 15 minutes ago?
Correct.
All right, for my secondary assessment, I'm going to assume this is something with the pulmonary system. I might go ahead and recheck lung sounds, but I assume they're still wheezing. And since he has his inhaler with him, I would go ahead and try to assist him with that if possible. And now I'm going to get my blood pressure and all my vitals. Is it okay if I take your blood pressure today? might feel some pressure. I'll just have you relax. Alright, for blood pressure, I got 114 over 64.
Corrected is 96 over 62.
Alright, I'm going to go ahead and grab his pulse and check his respirations. Alright, respirations were 14 and pulse was at 68.
Pulse is 152. Respirations are 48. Shallow with audible expiratory wheezes and nasopharyngeal.
Alright, and his SpO2 is still at 87.
Correct.
And then how are his pupils?
Pearl.
Alright, I'm going to go ahead and state my field impression, which I believe this is a 7-year-old boy having an asthma attack. For my interventions and treatments, like I said, I have him on a non-rebreather mask at 15 liters per minute. I also would help him assist in using his inhaler. Other than that, there's not much that I can do at this point. I would reassess his vitals every 5 minutes. And I'm going to go ahead and give my report at this time. This is Medic 1. I have a 7-year-old boy with possible asthma attack. He has severe wheezing in his lungs, which are audible even to the ear. He is allergic to amoxicillin. He does have an inhaler, which I assisted him with. He has a pertinent past medical history of asthma. And his last oral intake was lunch. He said playing on the playground has made this breathing worse, and I assume this is what caused the asthma attack. He looks like he's in severe distress. This started about 15 minutes ago, and I am also going to give you his repeat set of vitals, which at this time are
100 over 68. Pulse is 139. Respirations are 42, and SpO2 is 92% on 100% oxygen.
all right. Repeat vitals are 100 over 68. Pulse is still at 139. Respirations are 42, and SpO2 has increased to 92%. We're about 15 minutes out.